We are very, very lucky to have with us in the studio today Dr. Atsuko Okabe. She's a breast surgeon at MedStar Franklin Breast Health Center. It's October, it's breast cancer awareness, and we are talking about treatment for breast cancer. Doctor, thank you so much for joining us. Let's talk about how treatment has evolved. You said you've been practicing, what, more than 20 years now?
Yes.
All right.
Yes. So there certainly have been a lot of advances in breast cancer. So gone are the days when we had mastectomy as the only choice for breast cancer. So I think one of the biggest changes was what we call breast conservation, where a woman can have lumpectomy, just remove a portion of the breast and followed by radiation therapy. And even for women who do have to have mastectomy, we now offer for certain women what we call nipple-sparing mastectomy, so that with immediate breast reconstruction, sometimes it's very difficult to tell that they even had surgery.
And this is important that we've come such a long way, because getting that diagnosis and what do I do next is very, very scary for women.
It is. And I think, you know, for every woman, it's the dreaded diagnosis, and it's frightening and it's scary. But I think that's why it's so important to have early diagnosis, because that is when the woman has the most options of treatment and is able to take advantage of all these advances that we've reached, you know, in the current age. And even if there is advanced breast cancer, sometimes we can shrink the tumor down with chemotherapy first. So a person who might have had to have a mastectomy at first can now have a lumpectomy with radiation. And I think you're going to hear a little bit later from Dr. Fowler that there's been advances in radiation therapy as well. Used to be every day for 6 to 7 weeks, and now we can treat the women sometimes in 5 days and they're done with the radiation, or in some instances, one time in the operating room. So he'll tell you more about that.
Why is it so important for women to have different options for treatment?
Well, number one, I think it's great to have the options. You know, for all women, it's a very individualized process. And so one size does not fit all for what type of breast cancer treatment that a person has. And I think it really helps the woman, even though it can be a little bit confusing at times, as long as, you know, they have a breast surgeon and a breast multidisciplinary team that can explain all the options, then she's able to decide what is the best step for her going forward.
Okay, Dr. Okabe, thank you so much for coming.
All right. Well, thanks so much, Kelly. I really appreciate being here.
We got house calls going on next door, so you can give them a call at 410-481-2222 to get your questions about your breast health answered. Jamie?
Get over there. Come on.